Okay.
Okay, yeah, that's fine.
Sorry.
We're all waiting for you.
Sorry.
Okay.
Hi, you're nice to meet you.
Perfect. So you can actually, I just want to make sure this is good. You can take a seat right there.
I don't know what I volunteered for, so.
So we're also video recording this
Sure.
so that they can look at it later. Are you okay with that?
Fine.
Okay, perfect.
We might have to move a little bit that way so we can see your head.
Right,
See
sure.
yourself in the camera.
Yeah.
Yeah.
That's
Okay. I'll stand. I don't know. I'll just kind of stand.
Sure.
Okay, good. So I'll go through the whole thing head to toe. I'm just going to follow this. I don't have it memorized. So I'm going to have to look down. Want me to hear you? Oh. I might need to look down now. I'll keep it here if I need to kind of.
Let's read out every statement.
Oh. Okay.
Or you can just leave it right here.
I'll just yeah, I can do it. That's okay. Okay. So, I'll just leave it. That's okay.
Reading would be nice because it'll say, initial view it.
Yeah, like whatever.
Like what I would do is I would take it like this. Introduce yourself, including designation.
Okay.
And then will we miss the flow of just doing it?
Yeah. Whatever.
Whatever you guys want.
Show of hands if you want it first, Fred, then she does. Kate does.
No, just do it.
Just do it.
Yeah.
Just
Okay.
Very good.
I'll just kind of leave that there.
Yeah. If we need it.
Okay, so head to toe. So I'm walking in the door. Derek's already sitting here. Hi, my name's Kate. I'm a nurse practitioner student, I would say. What's your name?
Derek.
Nice to meet you, Derek. So today we're going to do an OSCE. So it's a head to toe assessment. Go through everything. Does that sound okay with you?
Sure.
All right, perfect. So first, as I'm doing this, I am assessing your general health. So your general state of health, your affect, your facial expression, your mannerism, your dress, your grooming, your personal hygiene, gait, posture, speech, orientation, and attention span. So I'm just doing this throughout the exam as I'm talking with Derek. So to start off, we're going to do the integumentary system. So I'm going to start with the upper extremities. So I'm going to inspect first. Always start with inspection. So I'm inspecting upper extremities. I'm inspecting for any color, lesions, dryness, moisture, hair pattern, distribution, and edema. Good. So now I'm going to inspect the nails. So I'm inspecting the nails for color, shape, lesions, nail angle, and capillaries. Good. Now I'm going to palpate. So I'm palpating for temperature, turgor, texture, and moisture. I'm going to now move to lower extremities. I'm going to do the same. So I'm inspecting to start off with color, lesions, dryness, moisture, hair pattern, distribution, and edema. I'm going to make sure I include the soles of the feet and in between the toes bilaterally. Next, I'm going to inspect the nails. I'm inspecting for color, contour, shape, lesions, nail angle, thickness, and capillary. I'm going to palpate next lower extremities, temperature, turgor, circulation, for any blanching or edema. Now I'm going to move on to HEENT. So I'm going to inspect the head to start. I'm just looking, generally noting. I'm looking at the skull. I'm noting any deformities. The scalp. I'm noticing any tenderness, lesions, nodules, scaling. I'm inspecting and palpating at the same time. Good. I'm noticing the hair quality, distribution, texture, and if there's any infestations. Good on that one.
Good.
So facial structures now, I'm noting symmetry, masses, any edema. Everything looks symmetrical. I'm going to now inspect and palpate the temporal mandibular joint. So as I'm doing this, I'm going to test cranial nerve 5, the trigeminal nerve. So for the motor component, I'm going to get you to clench your jaw and then teeth back and forth. Perfect. I'm going to now assess the sensory component. So I'm going to get you to close your eyes. I'm going to touch different spots in your face. You tell me if you feel it. Good. You can open your eyes now. I'm going to now test cranial nerve 7, the facial nerve. So for the motor component, I'm going to get you to eyebrows up, down, puff your cheeks out. Good. Smile and frown. Good. The sensory component for cranial nerve 7 is on the anterior aspect of the tongue, so I get different taste buds tested there. Next, I'm moving to your eyes. So I'm going to inspect the external eyes and just noticing, looking at everything, looking for symmetry, lashes, lids, eyebrows, noticing the sclera, the conjunctiva, pupils, irises. Good. I'm noticing any ptosis. So at this time, I'm going to now do some cranial nerve testing. So cranial nerve 2, the optic nerve. So this is going to be testing through the Snellen chart, test your visual acuity. So what I'm going to do is I'm going to explain how to do it. If I'm going to get you to cover one eye, and then we would test your visual acuity. Then we would do your other eye, test your visual acuity, both together. Make sure you're wearing glasses if you have any or contacts. So now we're going to do visual fields. So what I'm going to get you to do is right in front of you here, I'm going to get you to cover your eye like this. And I'm going to bring my hand in different angles. You tell me when you see my fingers.
See it now. 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 Now.
Perfect. Now we're going to do the other eye.
Now. 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 Now.
Perfect. Good. So now we're going to test the oculomotor. Let's grab my stuff here. I'm going to test oculomotor cranial nerve 3. So I'm going to just get you to look straight ahead. I'm looking in your pupils. I'm noting direct and concentric pupillary constriction. Good. So now I'm going to test cranial nerve 4 and 6, the trochlear and abducens. So to do this, I'm going to do extraocular movements. So I'm going to hold your chin. I want you to look at my finger and follow my finger. Good. I'm not noticing any nystagmus. I'm going to check for convergence as well. Good. Now I'm going to inspect the ears. So I'm inspecting the position and alignment of the external ears, comparing bilaterally. I'm going to palpate the auricle, tragus, and mastoid process. No tenderness?
No.
Good. Now I'm going to test cranial nerve 8, the acoustic nerve. So I'm going to get you to, I'm going to cover this ear. I'm going to say a 2-syllable word. I want you to repeat it.
Baseball.
Good. I'm going to do the same on this side.
Tuesday.
Perfect. Now I am going to do the Rhine and Weber test. So the Weber test I'm going to start with. I'm going to strike this tuning fork. I'm going to put it on your head, and I want you to tell me if you feel vibrations equally in both ears.
Sure.
We don't have a big enough tuning fork. This is the 128. This is the 512. So I should be noticing equal vibrations in both ears. I'll try the Rhine test, but we may not notice it. Oh.
I don't know if it's my hair.
So we're going to do now the Rhine test. So I'm going to put it behind your ear. You tell me if you feel any.
Yeah, I do.
Yep. Tell me when you stop feeling it.
No.
Good. And then do you hear it there?
Yeah, yeah.
Good. So I want to note bone conduction or air conduction is greater than bone conduction. I'm going to do it on the same on this side. Tell me when you stop feeling the vibration.
Here. Yeah.
Perfect. Good. Now we're moving on to nose and sinuses. I'm going to inspect the external nose for deviated septum. Good. And I'm checking the patency of the nasal passages. Good. I'm also going to check the septum and the turbinates. Nasal mucosa, everything looks good. So next we're going to test cranial nerve 1, the olfactory nerve, which is a sensory component. So I don't have the stuff. How I would do it though, so I would get you to cover one nostril, get you to smell a familiar smell, do the same on the other side, something like coffee and orange, something you can really smell. Next I'm going to palpate the bridge of the nose. Symmetrical, no pain, no deviation. Perfect. Now I'm going to, palpate and percuss different sinuses. So the frontal sinus. Close your eyes for me. Maxillary and the nasoethmoid. Frontal, maxillary, ethmoid sinuses. Now I'm going to inspect the pharynx. So I'm going to inspect the lips. Good. Buccal mucosa. I'm going to get you to open your mouth. Your gums and your teeth. Good. Your palate, tongue, pharynx, tonsils. Good. Everything looks good. So next we're going to test cranial nerve 11 and 9 and 10, glossopharyngeal and vagus. So I'm going to get you to open your mouth again. I'm looking at your uvula, noting the soft palate. I would get you to do a gag reflex here by putting your tongue depressor in the back of your throat. Good. And finally, I'm going to test the sensation by the posterior 1/3 of your tongue, different taste back there. Finally, I'm going to test the cranial nerve 12, hypoglossal. So I'm going to get you to stick your tongue out, move it back side to side. Good, and repeat light, tight, dynamite.
Light, tight, dynamite.
Perfect. Next, we're going to move down to the neck. So we're going to inspect the position of the trachea. Make sure it's midline. Good. We're going to check cranial nerve 11, the spinal accessory nerves. So I'm going to get you to shrug your shoulders. Good. Another shrug. Good. I'm going to get you to turn your head to the side. Good. Other way. And then rotate like this. Perfect. Good. So now we're moving down to lymph nodes in your neck. So I'm going to palpate all 10 lymph nodes, preauricular, postauricular, occipital, submental, submandibular, posterior cervical, deep cervical chain, superficial cervical, tonsillar, and supraclavicular. Good. So now I'm going to move on to the thorax and lungs. So I'm going to come around to the back. So I'm inspecting the back. You're not in a gown here, Derek, but you would normally be. So I'm inspecting your back. I'm inspecting the color for any respiratory distress, the respiratory rate, symmetry, and any lesions that I note on the skin. Everything looks good. I'm noting the AP diameter, and I'm noting the ratio should be 2 to 1. Respiratory expansion, so I'm going to put at my thumbs equidistance level 9 and 12. I'm going to pinch the back. I'm going to get you to take a big breath in, and I'm noting equidistance of my thumbs coming out. Good. As I'm doing this, I'm thinking about all the imaginary lines for anatomy. So I'm thinking of the sternal line, the mid-clavicular line, anterior and posterior axillary lines, mid-axillary, vertebral, and mid-scapular lines. Good. So now I'm going to do some palpation. So I'm going to palpate for any tenderness across the paravertebral muscles, starting at the top, working my way down. Any tenderness, Derek?
No.
So now I want to check for tactile fermentation. So I'm going to get you to say 99.
99,
Keep going.
99, 99, 99.
Good. So I'm noting the vibrations that I'm feeling through my hand are equal bilaterally to the bases. As I'm at the back here, I'm going to check for CVA tenderness. So I'm landmarking the kidneys. Tell me if you feel any tenderness.
No. Nope.
Perfect. All right, so now we're going to do some percussion. So we're going to make sure we are starting at the apex and moving to the base, and making sure I'm doing a minimum of 6 on each side. So I'm noting dull and resonant percussion sounds. I'm also noting some hyperresonance. Good. So now we're going to do some auscultation. I'm going to get you to fold your arms in front of your chest. Perfect. I'm going to get you to breathe in and out through your mouth just a little bit deeper than normal. So I'm auscultating a minimum of 6 on each side. I'm listening for bronchiovesicular and vesicular sounds. I'm not noticing any crackles or wheezes. And I'm ensuring that the stethoscope lies on for full inspiration and expiration. Now I'm going to assess the right middle lobe. So at the 5th, 6th intercostal space, at the anterior axilla line, I'm going to get you to take it in and out. Good. Alright, so now we're on to cardiac assessment. So I'm going to move back now to the heart. So I'm always inspecting first, so I'm inspecting for any pulsations, any heaves, looking at your chest wall, everything looks good. I'm going to palpate now, generally for any heaves, thrills rather. I'm also palpating the apical pulse right now. I'm going to palpate your carotid arteries, making sure to do one at a time. Now I'm going to auscultate your carotid arteries. So I'm going to get you to take a breath in for me and hold it. Good, and you can breathe out. In again, and hold. Good. I'm not hearing any bruise in the carotid arteries. Now I'm going to auscultate different cardiac valves. So I'm going to start in the 2nd right intercostal space. I'm listening to the aortic valve right now. I'm listening now to the pulmonic valve in the 2nd left intercostal space. At the lower left sternal border in the 4th intercostal space, I'm now listening to the tricuspid valve. And at the 5th intercostal space, mid-clavicular line, I'm listening to the mitral valve. I'm also listening for S1 and S2. S1, best heard at the apex. S2, best at the base. I'm also making sure there's no physiologic split. I'm now going to listen to each of the areas again with my bell. I just listened with the diaphragm. So the aortic, the pulmonic, the tricuspid, and the mitral. Good. Now I'm going to palpate different pulses. So I'm going to start with the femoral pulses. So I'm comparing bilaterally. The popliteal pulses bilaterally. Dorsalis pedis pulse bilaterally. And posterior tibialis. Good. Next I'm going to move on to the abdomen. So I'm going to inspect your abdomen. Do you mind lying down?
Yeah,
Okay.
sure.
Do you mind pulling your shirt off?
No, I don't.
Is that okay?
Take it off.
No, if you just pull it up, that would be awesome. Thank you very much. Okay, so I'm going to inspect the abdomen, same as what we've done before. I'm looking for color, contour, symmetry, masses, striae, scars, pulsations, dilated veins, and any peristalsis. Good. I'm going to auscultate now. So I'm auscultating in all four quadrants. I'm listening for bowel sounds. It should be normal, hyperactive, or hypoactive. While I'm auscultating, I'm going to auscultate for any bruits. I'm going to start with the aorta, the renal arteries, making sure to compare bilaterally. And the iliac arteries. Sorry, iliac was at the top, renal at the bottom. Renal. And then femoral. I'm going to percuss now. So I'm going to make sure I'm percussing all four quadrants. I'm listening for tympany or any dullness. Now I'm going to palpate. So I'm going to get you to put your arms just at your sides. Your knees are bent, so this is the best position. So I'm going to do light palpation to start. Oh, sorry, my hands are cold here. So I'm doing palpation in all four quadrants. I'm noticing any resistance, tenderness, or superficial masses. So next I'm going to find the liver. So what I'm going to do is I'm going to percuss the border of the spleen. So I'm going to start in the right lower quadrant. I'm going to percuss up from tympany until dullness. I'm going to note the bottom edge, then I'm going to percuss down from resonant to dull. So I'm noting the liver span. I'm expecting it to be about 6 to 12 centimeters at the mid-clavicular line. Now I'm going to palpate the liver. So I'm starting in the right lower quadrant, and I'm palpating up. I'm going to get you to take a breath in for me, Derek. Good, and out. Good. Another in, and out. Perfect. So now I'm going to find the spleen. So the spleen's at the 9th intercostal space, the anterior axilla line. And a landmark to find the 9th intercostal space. And I'm percussing for any splenic enlargement that I don't feel. Now I'm going to palpate the spleen. So I'm going to start in the right lower quadrant. I'm going to get you to take a breath in and out. Another in and out. Good. And one more in and out. Perfect. Good. So I don't notice any splenic enlargement. Finally, I'm going to palpate the aortic pulse. So I'm noticing the quality of the pulsation. Good. Alright, so you can sit up for me there, Derek. Thank you. So we're going to move on to musculoskeletal. So, always starting with inspection, I'm inspecting muscles for bulk, mass, symmetry, any involuntary movements, inflammation, or deformity of the joints. So I'm inspecting both upper and lower, comparing bilaterally. Good. Now I'm going to palpate. I'm palpating for any tenderness, muscle bulk, and mass. Again, upper and lower extremities bilaterally. I'm going to test range of motion in your neck. So I'm going to get you to follow these different motions after me, okay? So flexion and then extension of the neck. Good. Rotation. Lateral movement. Perfect. So I've just checked range of motion in the neck. We're now going to check range of motion in your upper extremities. So we're going to start with your shoulders. I'm going to get you to stand up, or maybe just a little bit easier. So if you can follow after me, different movements with your shoulders. So flexion, all the way up. Extension, good. Abduction, adduction, external rotation, internal rotation. Good. We're going to check your elbows now. So if you can flex them, yep, and extend and flex, good. And then you're going to put your hands like this, rotate them, supination and pronation. Good. Now wrists, we're going to extend them and flex them. So we're going to ulnar radial and ulnar deviation. Perfect. We're going to clench our fist, that's flexing all of our fingers, and extend, make a big hand. Perfect. Make your thumb a pose, we're checking that. Good. Check upper extremity, active range of motion. Now we're going to do lower extremity. So we're going to start with your hip. You can hold on to this, and I'm going to get you to put your leg forward for flexion of the hip, and then backwards is extension. And then you're going to do the same thing on the other side, flexion and extension. And then I'm going to get you to put your leg out and in. So abduction and adduction. Same on the other side, abduction and adduction. So if I can get you to lay down one more time here. Perfect. So we're going to check one more for the hip. So I'm going to get you to bend your leg, externally rotate and internally rotate. Good. External rotation and internal. If you can do the other on the other side, please. External and internal. Perfect. You can sit back up. So I'm going to get you to extend your knee out and then flex it back in. Same on the other side. Perfect. Good. So now we're going to move down to, we've done hips, knees, we're going to move down to feet. So I'm going to get you to push down on the gas pedal. Good. And that's for plantar flexion, and then pull up towards the ceiling, dorsiflexion. Same, plantar flexion, dorsiflexion. We're going to do inversion, get your feet to go in, and eversion. Perfect. Going to get you to crinkle your toes down, flex them, and then extend them back up. Great. So we've now done active range of motion in both upper and lower extremities. So we're going to test muscle tone now. So we're going to test tone by moving your extremities through passive range of motion. So what I'm going to get you to do is relax your arm as best you can. Good. And I'm going to support your arm. I'm noting mild, even resistance. Compare side to side. Again, mild, even resistance. Good. Now I'm going to do the same for feet. Relax your leg. Mild, even resistance. Flexion and extension. Good. Finally, we're going to test strength, and this is against resistance. So we're going to go through again, head to toe, just get you to move different directions, and it's going to be against my resistance, okay? So I'm going to get you to do your neck, rotate it, good, and then lateral movement, good. I'm going to get you to do shoulders out to the side, abduction, good, and then in, adduction, good, backwards, extension, flexion, and then elbows get you to bend, flex them, extension, wrists, flexion, extension, good. I'm going to get you to do for your hips, bring your knees up to the ceiling for me.
Both.
Yeah, but you can do one at a time or both, whatever's easier. Good. Good, and then comparing side to side. I'm going to get you to put both legs out against my hands. Good, and pull back in. Good. Push down on the gas pedal and toes up to the ceiling. Good. So we've just done against resistance. We've checked your strength. So we're moving on to neurological assessment. So I'm going to get you to stand up for there. So I'm just going to get you to walk over to the end there. I'm inspecting your gait, noticing it's even, mild, perfect. And then the next time I'm going to get you to do tandem walking. So that's heel to toe like you're on a tightrope. Perfect. So I'm checking for balance. Great, and then come on back. Now we're going to do a Romberg test. So we're going to get you to stand with your feet pretty close together. Perfect. And I'm going to get you to close your eyes. I'm noticing, this is for proprioception, I'm noticing any sway or falling. I'm gonna wait about a minute. That's done. Good. Get you to open your eyes. So you're gonna put your feet a little bit farther apart. Both hands are gonna go up, and you're gonna put your palms up. And I'm gonna get you to close your eyes again. So I'm checking for any pronate or drift. Perfect. Take a seat back up here, we're almost done. So we're going to test for coordination now. So to do this, I'm going to get you to put your palms on your knees and then flip them over like this. I want you to go back and forth as quickly as you can. Perfect. So just check for coordination, everything looks good. We're going to do some sensory testing now. So first I'm going to start with the spinal thalamic tract. I'm going to do the test for light touch. So what I'm going to get you to do is I'm going to get you to close your eyes. I'm going to touch you lightly in different spots, and I want you to say yes if you feel anything. Okay?
Yes. 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 Yes.
Perfect. So I've just checked the spinal thalamic tract, and everything is intact for that. Next, I'm going to check the posterior column. So I'm going to do this by checking for position, proprioception. So I'm going to get you to hold your hands out for me. I'm going to get you to close your eyes. I'm going to hold your finger and I'm going to move it up or down. You tell me what direction you feel it moving.
Up. Down. 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 Up.
I'm going to do the same for your big toe, okay?
Down. Down. Up. Up.
Great. You put your arms back down on your eyes. So just check the posterior column. Everything looks intact. So I'm going to check for reflexes now. I'm going to start with the biceps tendon. I'm going to get you to relax your arm as best you can. Good, so I've noticed a good response. I'm comparing side to side. Relax your arm more. A little bit more. I want you to, on the count of 3, clench your teeth. 1, 2, 3. Perfect. Alright, so knees. We're going to do patella. Good. I'm going to do Achilles. So I want you to relax your leg. Good. Good. So finally, I'm going to check for a Babinski response, which is any plantar response. I'm going to get you to put your foot up. Good. So I'm noting downward curling of the toe. Good. All right. So we're done now, Derek. Thank you for your help. That was great.
No problem.
All right. Okay, so questions? Yeah. That's, we talked about that. Yeah, you should, yeah. Yeah, I didn't do that. If you didn't do it, I don't know if I would.
For the abdomen, you did percuss, then palpate, and then back to percuss for the liver. Is that how you ordered it?
I just followed the sheet. So that's what we had done yesterday. So we palpated it, and then we percussed it, and then we palpated it. I think that's what it's saying.
Yeah, and then we go back to it.
Does it matter as long as it's listed first?
Yes. No, it's just you should percuss to find the span of the liver, so you know where you're palpating.
Also for the Romberg test, should we say we're looking for proprioception and for the coordinator drift upper external movements?
You should, yeah.
Oh, we have to say it? Okay.
Yeah, I would like you to say it. Yeah.
Okay.
For renal and iliac artery?
Yeah.
First you said
Yes,
aorta,
I had
iliac,
it's
and then you
aorta,
Renal.
iliac. Yeah.
You said
I said
it right,
and then
you
I
said
changed it. Okay. Yeah.
And another thing, did you check the trachea, the alignment?
Yes, so I inspected it and for any deviations.
That's really hard to do the iliac.
Yes. Yeah.
You're just doing it for,
Just to know, you know where the anatomy is really.
If there was a door right here.
Pardon? Yes, palpated it. Yeah.
oh,
And with it doesn't say, but it should be 2.5.
Do we say
So
it?
you don't have to. You don't have to say that. Just not on our sheet.
We just say it.
Yeah, you don't have to measure it. It's just palpate. Make sure the quality of the palpation. Yeah.
Only if they're over 50, do we have to worry about measuring according to the person? Age?
Or if it's significant.
Yes.
In the one of the videos that we watched for aortic palpation, it looked like the clinician was really getting in there and trying to find the borders.
Depends on the size of the person. On a skinny person, you can see it. On a
Yeah.
bigger person, you're gonna have to push a little bit harder. Yeah, depending on the size of it, you're not gonna find it probably.
I noticed a lot of times you were stating what you were doing, and other people had asked us to give sort of findings,
Yes,
normals and things like that.
I just
No?
I don't
Like, oh, say what you expect to see.
I don't think
What do you mean?
You're looking for, but you're not finding it.
Right, so what you're looking for, like what normal is, so you can say that's what I'm looking for.
I'm looking
Yeah.
for normal hyperactive or active cells.
Yeah.
But I'm not saying that I'm finding.
Right, maybe I
did I
No,
did you want it differently?
no, I just thought I just had more detail.
Yeah, you when I watched you, you had a lot of detail, which is awesome. But you no, it's not too much. But you don't have to say all that detail for this.
For the shoulders, should we add circumduction?
If you've done full flexion, extension, and abduction,
We've done all 6 of them, do we add the 7 and the circumduction as well? Or?
you've done internal and external rotation. That's fine.
What is circumduction?
Okay. It's not.
I thought you had to do it.
Oh, okay.
So just going back to palpating the aorta.
Yep.
Since we're not feeling, as Anna said, for the borders, do we just palpate it like we would palpate any pulse?
Yep.
For their run test, do we have to time, you know, the air conduction to be
Greater,
Yeah.
twice as long as bone
Yeah, so
conduction.
do we actually have to time it, or do we just listen and say it's greater?
Just say that it's greater than air conduction is greater than bone conduction.
Just
That should be
say
enough.
actually.
No.
In the video I watched, it was like almost a minute for you to hear. It was ridiculous.
Yeah, no.
You don't have time to do that.
No, okay, so we don't have to time it.
It also asks to describe what S1 and S2 is, so should we say S1 is the shut of the valve?
Oh, yeah. Does it say to describe what it is, or just where it's festered?
It describes what S1
Oh, sorry.
is.
Yeah.
And the physiological split R and the location where
Yeah.
it's vested.
Yeah, sorry, I didn't do that.
So
But yes,
you should say that it's the valve.
yes, it's the valves closing and opening. Yeah.
Okay.
For the AP diameter, it's 1 to 2 ratio.
Sorry, I said 2 to 1, didn't I?
Oh,
Yes. Yeah. Good. Any other questions? Nope. So how long does that take? I didn't
Not that long.
Oh, 35.
35. So that was from.
Like till right the second?
Well, we've been talking about 34.
So realistically, you've got 45 minutes. You can do that. And I was looking at my sheet.